Did you know that April is Occupational Therapy Month? Hi, my name is Rachel and I'm a doctor of occupational therapy at Physio Partners. In this video, I would like to talk to you a little bit about what occupational therapy is, talk about some of the conditions and concerns that I often see while working at Physio Partners, and tell you a little more about my journey into becoming an occupational therapist. To start off with, let's talk about what occupational therapy is. Sometimes people are a little confused about that term occupation within the context of occupational therapy because they'll think of paid employment or one's profession. Occupation within the context of occupational therapy actually refers to how one occupies their time. People occupy their time in different ways, and that changes throughout the day. It also changes throughout the lifespan. So some examples of occupations include getting dressed, preparing meals, exercising, completing work, spending time with family and friends, and taking care of loved ones. Occupations, or ways that one spends their time, also include some things that people might not think all too much about unless they're having pain or difficulty with them. Some examples of these occupations may include using the toilet, breathing, sitting, and sleeping. So the field of occupational therapy addresses the physical, mental, and environmental factors that make it difficult for someone to participate in one or many of their occupations or their daily activities in the way that they would like to. Some common barriers include when someone is dealing with pain or illness or recovering from an injury that just makes it harder for someone to do some of the things that they would usually do. If this resonates with you, if you could think of something that's a challenge for you or someone you know, they might benefit from occupational therapy. At Physio Partners, I work with patients who have conditions of the shoulder, elbow, wrist, and hand. That is more of my upper extremity focus. And I also work with patients who have pelvic health conditions, such as pelvic pain, difficulty controlling bowel and bladder function, prolapse, also people who are experiencing pain with sexual intimacy, and people who also are having difficulty with abdominal control. I also work with patients with a variety of conditions and diagnoses such as arthritis and cancer. I have previous experience working in a trauma hospital where I worked with critically ill patients and also patients who were recovering immediately after surgery. So I do use some of my prior experience while working in the outpatient setting. I was initially drawn to the field of occupational therapy when I was a child. My mom actually received occupational therapy services to address some challenges that she had related to her hands. And I saw the amazing effect that occupational therapy had in her life and her ability to do the things that were important to her. After witnessing the occupational therapy process as a child, I made it my own goal to be able to do similar services for other people. If you have any questions at all about occupational therapy, I would be very happy to discuss this with you and see if you would be a good fit for occupational therapy or if someone you know would be a good fit. Throughout April, we're hoping to continue to send information about what occupational therapy is and just kind of give you an idea of other ways that occupational therapy plays a role in people's lives. If you have any questions at all, feel free to get in touch with a Physio Partners front desk staff who could put us in touch. My name is Rachel Phillip, and again, I'm an occupational therapist at Physio Partners.